New York State Nurses Association holding a town hall tonight to address women's health care services they say are under attack right here in the capital region. As soon as next week, surgical services will be moved from Bellevue Women's Center to Ellis Hospital. News 10's James De La Fuente shares their concerns of what's to come next under the Ellis St. Peter's Health Partners merger.
Women's health care is falling farther and farther behind. We should be ashamed of ourselves in Schenectady County that we are allowing our young women to receive worse and worse care. We need to take care of our women, and we need to do better.
Please, let's protect what we do at Bellevue. Please let's not let corporations take over what we do.
People spoke passionately tonight, both of those who received care at Bellevue and those who work there. They fear the impacts on women's health care services as a result of the Ellis merger with St. Peter's Health Partners. Starting next week, surgical services will be cut from Bellevue and 14 nurses will be laid off. Leadership with Ellis promised only abortions would not be allowed under the merger with a Catholic hospital.
Don't tell us that you're not going to do something and then you do it anyway. We're not stupid. We're aware. We're educated. We know what's going on.
Members of the community say more should be done to inform patients.
Healthcare without a voice in the process, like the Local Input and Community Healthcare Act, which would require public notice, meaningful engagement, and stronger state review before any hospital or critical service line could close.
Many of the concerns brought up about Bellevue came to the forefront when St. Peter's suddenly announced the closure of the Burdett Birth Center in Troy. After a public outcry and state infusion of cash, that was kept open for now.
As these changes are underway, we may eventually face the same fate. We are all here tonight because Ellis needs to invest in its nurses, its local community, and put patient care over corporate profits.
Some asking the politicians in the room what they were doing to save Bellevue.
Is there anything you guys are doing right now or to address this?
The room silent for a moment until Assemblyman Phil Steck urging the people need to speak out to the governor and lawmakers.
We don't want to lose that. That is important to medical care for the community, and all the other stuff is just, well, it's BS.
Ellis Medicine reiterating, Bellevue Women's Center remains fully open with no plans to close. Maternity patients, including those receiving planned and emergency C-sections, will continue to be cared for at Bellevue. Other key women's health services, such as mammography, also remain unchanged. Reporting in Schenectady, James De La Fuente, News 10, ABC.